Services Committee meeting held on Thursday, July 29th, 2021. It is now 7:09 p.m. You may view this hearing online by simply following our New Haven Board of Alders page on YouTube and hit subscribe and even like. That'll be nice. Board of Alders notice New Haven. The Joint Community Development, Health and Human Services Committee of the New Haven Board of Alders will convene, as I've already stated, online. We will hear and act upon Legislative Matter 2021-0326, order of the Board of Alders authorizing the mayor to accept CARES Act funding awarded from the U.S. Department of Housing and Urban Development from Community Development Block Grant, Coronavirus CDBG CV3 funds, per the order of Honorable Brian Wingate and Honorable Darrell Brackeen Jr., co-chairs attest, Honorable Michael Smart, City Town Clerk. For accessibility-related accommodations, please call 203-946-7651 voice or 203-946-8582 prior to the meeting. And again, in order to view this meeting right now live, go to the New Haven Board of Alders YouTube page and click the link there. Okay, now we will introduce members of the committee, starting with my honorable co-chair.
Thank you, Alder Brackeen. Alderman Brian Wingate, Ward 29, Beaver Hills, Chair of the Community Development.
Alder Frank Douglas, Ward 2, Vice Chair for Community Development.
Before we continue, I actually missed a note that should be read for the record. Since the meeting is remote, participation by a quorum of members is expressly prohibited at physical location and will not be present. However, any member of the public may request in writing a physical location and electronic equipment necessary to attend the meeting in real time, no later than 24 hours prior to the meeting. Said individuals shall have the same opportunities to provide, comment, or otherwise participate in the meeting as would be afforded if the meeting was held in person, with the following exception: under law, if such person loses the ability to participate because of any interruption, failure, of degradation of such person's connection to the meeting by electronic equipment, it is not required to adjourn or postpone the meeting. We will continue. Third Officer DeCola.
Oh, sorry. Sal DeCola, Ward 18, CD.
Alder Kim Edwards.
Alder Kim Edwards, Ward 19, Community Development.
Alder Carmen Rodriguez.
Alder Carmen Rodriguez, Ward 6, Community Development.
Alder Sabin.
Alder Eli Sabin, Ward 1, Health and Human Services.
And I will call Alder Cupo. Okay.
Alder Cupo, Ward 8, Community Development and Health and Human Services.
And I'd like to welcome other members of our board: Alder Adam Marchand, Alder Roth, President Walker Myers, and Majority Leader Richard Furlow. Thank you all for joining us. We will now proceed to the legislative matter before us, and we will bring to the screen our friends from the Budget Office, Mr. Ron Gizzi and friends, which I believe Dr. Galal is here. Okay, once you both have virtually joined us and are all set, please state your name and addresses for the record and state your case.
Hi, Ron Gizzi from the Management and Budget Office, 219 Arraymo Terrace, Hamden.
Hi, good evening. Mehul Dalal, Community Services Administrator, 115 Linden Street, New Haven.
So I can kind of start us off what we're looking at here tonight. So we did receive another round of CDBG CV funding in the amount of approximately $1.3 million. And this is in addition to the 2.2 that we've previously received and has been allocated now. So with this 1.3 million, we do need to amend our action plan again. It's a substantial amendment because of the amount. So that's what we're here to do tonight. This public hearing tonight covers the public hearing requirement by HUD. So that's covering this tonight. We do need a 5-day comment period, public comment period for this funding as well, as opposed to a 30-day for the regular CDBG process. And then once hopefully the full board will approve the action on Monday, and then we can post it in the paper on Tuesday, keep it open till Monday, August 9th, and then we can submit it to HUD. So this funding, this plan has to be submitted to HUD by August 16th, or we will lose this money. So what we're doing here, we're trying to be broad with this funding. So we have a few different options. So this is basically we're using this money for homeless. So there's 3 categories that we're using. It's rapid rehousing and homeless prevention, emergency shelter assistance and assistance to unsheltered, and then housing assistance and housing stabilization. So again, I did talk to HUD. They want us to be broad with these categories so we don't have to do another substantial amendment to the plan. And I think Dr. Dalal will speak a little bit more about the details of what we're planning to do with this funding.
Thank you, Ron, and always happy to be considered as part of the Ron and Friends group. Alder Brackeen, Chair Wingate, members of the Joint Committee. Well, I think Ron did explain the process pretty well. I can fill in a little bit more detail on some of our needs as they've evolved over the course of the pandemic. These dollars are, allocated toward pandemic response, but in a relatively broad way, including helping individuals who are experiencing homelessness. One of the gaps that's apparent in the context of the pandemic is sheltering capacity. We do continue have to abide by social distancing rules within shelters. What that means is that any individual shelter has to reduce their capacity sometimes, by 50%, sometimes by even more, by 60, 70%. So we are faced with a situation that we would likely need to either acquire, purchase, or rehab an existing facility to help expand our sheltering capacity to meet the COVID guidelines and protocols. So I think Ron referenced those 3 categories. We do want to keep it broad, but I also do want to share with this group that probably are most likely used for these dollars, so that we don't have to tap into the rescue plan dollars necessarily that the city received, is to allocate this towards either the acquisition or rehabilitation of a facility.
Thank you. I will ask the committee now, do they have any questions or comments in reference to the item that's before you? I see Alder Douglas.
Thank you, Mr. Chair, and the rest of the committee and the administration. My question is pertaining to the shelters and the facilities that are used for homelessness now. Are these funds available also for folks willing to open their homes up to homeless to help with the homeless situation? Or is it for existing shelters only? Dr. Delisle, please.
Yeah, I'll start and then maybe Ron could weigh in. I may, and if I interpret your question correctly, if I don't, please correct me, is that it's not necessarily people that open their homes, but they are units throughout the city in the greater New Haven area that do qualify as affordable or deeply affordable units that landlords rent out. And we've made a substantial investment in the first tranche of the CARES Act in rapid rehousing, which means identifying properties, matching individuals who are experiencing homelessness to those properties, and then supporting them to move to those properties, including rental assistance for a period of time. We've actually on the first tranche made a substantial investment there, and those dollars are still available to agencies and they're currently spending those down. Those dollars aren't being used as quick as we could, Alder Douglas, because there's a shortage of housing. But anyone who's willing to, have an appropriate space of living open to them, then to collect rent that's affordable within the guidelines, we would welcome that with that previous tranche. Ron,
Thank you, Doctor.
Current tranche of dollars, whether they can be used in that way.
All right, thank you, Doctor. You basically you have answered my question. Thank you.
Is there anyone
More
else?
questions at this time, Mr. Chair.
Thank you, Alder Douglas. Are there any more questions from the committee or comments at this time? I see Alder Carmen Rodriguez.
Thank you, Mr. Chair. So Dr. Delisle, you mentioned that allocating this for a possible facility. I know we're moving quickly on this and you're talking and things need to be put in the paper within a certain amount of time and be open for the publics. Have you chosen any facilities? Do you have a thought in mind? Do you have a list of areas you're thinking of?
So the conversation about the facilities is the type of facilities that would meet the characteristics are, they really have to have a lot of things in place, and it's got to make sense for the neighborhood as well. So they have to have the appropriate HVAC system available, and if it's not available, we have to consider that as part of the expenses. It's got to allow for proper social distancing. It's got to allow for a relatively high volume of individuals that we anticipate that are experiencing homelessness in the coming months and years. So we don't have any concrete place in mind. This committee did previously, so I'll just, just for the sake of the discussion, this committee did previously approve the allocation of $500,000 in the previous tranche of CARES Act to go towards Columbus House when in support of their seeking an acquisition of the property. At this point, it seems relatively unlikely that their proposed acquisition will go through. So that is, not completely ruled out, but we don't think that's going to be the facility that this will support.
And when you say that facility, again, do you have a particular facility in mind?
Yeah, so what was proposed by Columbus House was the acquisition of the Village Inn and Suites Hotel in their proposal. And the committee supported $500,000 towards that if that deal was going to move forward. Again, we don't have any guarantees. In fact, it's probably unlikely at this point in time that that is going to move forward. So we would be most likely looking elsewhere.
Thank you for that. Thank you, Mr. Chair.
Can I
You're
follow up something
welcome.
on that with Dr. Delisle?
Yes, please.
Can I just follow something up on that?
Yes, you may.
I did speak to HUD. I talked to our HUD rep about submitting a plan without actually having a site in mind, and they said that was fine. We could do that. We could submit the plan without having a site.
Alder Saban, are you all set, Alder Rodriguez?
One more question, Mr. Chair, if I can.
Yes.
So if this comes to fruition, you would definitely, wherever this site may be, you are going to have community engagement, correct? Dr. Delisle?
Oh, absolutely. Yeah, I think that would be, again, it has to make sense in the context of the neighborhood where we would find such a facility. So community engagement would be a key part of it. And unless the property is already zoned, to support this kind of facility, I would imagine this would have to go in an additional public process, again, through zoning changes or zoning approval as well. So I think, this is not like kind of a blank check to just buy whatever property you want. I think this is just the first step. And so we can, communicate to HUD our intentions around these dollars.
Thank you, Dr. Delisle. Thank you, Mr. Chair. Final.
Thank you. Alder Saban.
Thank you, Mr. Chair. Thank you for being here, Dr. Delisle. I was wondering if you could tell us how many beds you are hoping to be able to provide in this new facility, if there's an estimate of the capacity that we need and how many you're hoping to be able to secure with this funding.
Yeah, so this funding would probably represent a contribution towards the acquisition or rehabilitation of property. Again, without a concrete facility in mind, it's hard to know exactly how much it would cost and what the acquisition and rehab costs would be. So it's probably safe to assume we couldn't do an entire facility with the 1.3 million and change that we're asking right now. We are anticipating additional dollars coming in and leveraging some more dollars that may be available at the state or nonprofits can access that the city can't to have a fully funded project. In terms of the need, it does, it is a dynamic situation. We don't know what's going to happen with the eviction moratorium and whatnot. Ideally, we would identify a facility that could accommodate about 150 individuals.
Understood. Thank you. And then an additional question, do you have any sense for the timeline that you're looking at in terms of identifying a building and then purchasing a building and securing additional funding if that's needed?
I don't have a concrete timeline, and the reason for that is that we don't have a great sense of what this winter will look like with respect to the amount of COVID protocols that will be in place, especially with the Delta variant. So for our kind of approach is to approach this in two phases, making sure we have a safe and secure environment for individuals over the winter, where we at this point must assume that COVID will still be circulating. And then once we get through that, over the course of the next year, and Ron, please weigh in in terms of deadlines associated with these dollars, we would identify the more permanent property where this could be established.
Right. I did have an additional question. I was wondering what is the timeline or deadline for us spending this money?
I defer to Ron on that.
The CDBG funding, this funding, it's a little bit more. We do have a few years to spend this funding, but there are timeliness requirements as well. So it is emergency funding. So we really should do our best to try to find a facility. In Alders also, anything in your neighborhoods where you would think would be a good place for facility, that would be great. I know Dr. Delisle's office is more working with nonprofit agencies and people in the public. The budget office, we're a little bit further removed from the public. We're doing more of the process stuff instead of the actual sites or planning for the sites. So anything the alders could contribute would be great, but sooner the better. But again, having it fit into a proper setting.
Thank you. And then one last question.
Alder, that's your third question. Your third one.
Fair to colleagues.
Okay. I would like to see if anyone else have another one before our esteemed Alder Fabian go back to his questioning. Alder Kimberly Edwards.
Thank you, Mr. Chair. I do have a question and a half a comment. You did address a couple of my questions, the timeline, and the search for the facility in the village. Those were my questions. I think maybe finding something in the downtown area may be great. Is there a great building we can look for near City Hall, near downtown, somewhere like that? Because everything's around downtown, accessibility. Whether someone needs mental health services, City Hall services, hospital services, I think that's a great area, in my opinion. I also had a half a question. You spoke of how with the rapid rehousing, you were placing people and dealing with the nonprofits. I had a question about how you select those people. I don't know if it's appropriate now, and if it's not, I'll ask that the chair get this information. But I did have a question with how you select people, the landlords, because I have had issues in my area where we do have some landlords that own a lot of properties that have been one of these rehousing places or partners, but they're not great partners because there's no wraparound services for the people that they're letting move in. So that is a concern for me because it's part of the homelessness issue and the nonprofits we're dealing with the landlords. So I don't know if that was a comment, a question, or a combination, but I would like more information on that if anything is available.
Yeah, I would happy to share more information. I don't have it on hand because the nonprofits deal with the landlords and the housing groups directly. So I don't have it on hand to directly answer a question about how they're selected. But I can tell you there's been a lot of conversation among the nonprofits around the fact that they don't want to house someone without supports because they will end up back in the system. And unfortunately, that is an occurrence that is known to happen. People sometimes cannot make it on their own without the proper supports. So there is, a small, percentage of folks that just can't make it on their own. And so the nonprofits are very cued into this issue and understand that there's a need for supports that go along with the housing piece.
Thank you very much, because I experienced it. We have a place next door to my home and around the corner, and I actually had one of the property owners, we had an LCI issue, and they tried to throw that in there. I'm doing this for this. And I said, well, you're not a social worker. So if you cannot make sure they're getting their wraparound services, I have an issue, because it's a danger. It's a danger to the people that need the services, and it can be a danger to a neighbor. So I'm sorry if I was out of line, but I thought that needed to be addressed. Thank you.
No, you're not out of line. I will ask the doctor to get that information back to Al Lucas and forward it to you as we go through this process. That part of it should not impede on what we're doing about tonight, but just for the information for your knowledge and how that happens, I think it's important that you get that. So we will request that from the doctor tonight, that we can, get some of that information. Not so much tonight, but when you can, as soon as possible. Are there any more questions or comments before I give it back to our esteemed Alder Fabian?
Thank you so much, Mr. Chair. I had one last question, which is if we're buying a building, presumably there might be some ongoing expenses to the city after this money runs out. And I was wondering if you have had any details or estimate of what that might be, just because if we would have maintenance or anything else like that.
Yeah, I think that I don't have the exact numbers, but I think because we don't know what the facility is, But I think that would be wrapped up into, whatever deal that happens with this, is to ensure that we have the ability to pay ongoing costs. I'm optimistic that the state will be a partner with us in terms of the service provision that is needed. I know there's been at least willingness expressed to do better coordination with the state funding and nonprofits and what the city contribution is. I think us showing as a city that we are contributing some resources, I think is a good signal to the state for them to step up and do their part as well with respect to this. So I'm hopeful that they'll be a good partner in whatever facility that we find to not just provide the ongoing kind of maintenance and operations costs for the building, but also the services that are going to be needed.
Great. Thank you, Dr. Dalal. Thank you, Mr. Chair.
Thank you. Thank you. I have a couple of questions. Is there anyone from the committee have any questions or comments? Okay, Alder Carmen Rodriguez.
Thank you, Mr. Chair. I too want to echo the sentiments of Alder Edwards, as we did have a situation here that became difficult for some of the residents. And so absolutely ensuring that if you are utilizing landlords, please ensure that there are wraparound services and that they are assisting these tenants, not just collecting on these tenants, so that we can ensure they get to where they need to go. Every individual is important, but we also have to remember that these landlords are, this is a business for them. And so please choose wisely. And absolutely, I agree again with my colleague. Busing services are available downtown and they can get to the hospitals readily available. And so again, wraparound services are important. Thank you, Mr. Chair.
Thank you. So before I go, I would like to know if any more from the committee like to have a question or comment. Okay, so just for clarification, Ron, you saying the timeline is August 9th, August 16th, we receive the money. We receive the money. We don't have to have an entity per se to have down to say, for us to recoup the money, right? And we don't have to have another public hearing, but you're willing to have another public hearing?
We don't need one. We only need one public hearing. There are some waivers that are in place for the CARES Act funding that state only one public hearing is required and only a 5-day public comment period is required, as opposed to a 30-day public comment period with the normal consolidated plan process.
Okay. So with choosing where this place would be or where the money would be allocated to, how do you think you will incorporate the alders?
Well, it's definitely going to be a partnership with the alders in multiple city departments as well. LCI, they probably know of some vacant buildings, so we'll work with LCI and CSA, and engineering is going to get involved in this also, depending on what needs to be done. So we could use the funding for acquisition. We could use the funding for rehabbing the properties, but depending what is needed. So that's why we are being kind of broad, but we also need to be flexible with this. So if the acquisition cost isn't as much, but the rehab cost is more, we can adjust that. Or if the acquisition is more and it doesn't need as much rehab, then we can use more towards acquisition. Just so we have that flexibility.
Yeah. So you have 2 years to, I guess, spend this money, but we want to we want to look at this stuff sooner than later, right?
Yeah, absolutely. Yeah.
Okay.
Yeah, there are some timeliness requirements with this funding. But, again, it is emergency funding. They do want us to use it quickly, but they want us to also use it effectively.
Okay. Well, before I turn it back over to my co-chair, Alder Brackeen, thank you. Thank you for what you've been doing. Thank you for your services. Oh, I see Alder South Dakota have one question.
Yes.
Your office.
Thank you, Mr. Chair. Yeah, I'm sorry I'm late on this question, but you brought it to, if we're going to acquire a building, then you need to come back to the board to purchase this building, correct?
Most likely, yeah.
So then there will be another public meeting on the purchasing of this because it would be in a public meeting, correct?
Yes, we can do that.
I just want to make sure that, just so we know the steps here. So you eventually, the questions are brought up, or there'll be another, it could be another public meeting if we purchase a building.
Yeah, so when I was referring to just one public hearing, it's only to submit the amendment to HUD. So,
Okay.
yeah, so that's only, just to secure the funding, we just need one public hearing and the 5-day public comment period.
Okay.
After that, once we have the funding in place and our plan is approved by HUD, then we can have many meetings. But again, that's not a requirement just to submit this part of the plan.
Correct. I just want to make sure that, so when people wonder about other meeting, there will be another meeting when we discuss a purchase and the location of a homeless shelter.
Yeah, and again, depending on what Alder's neighborhood it's in, the management team meetings, we can have management team meetings, we can have neighborhood meetings. So yeah, as many as are necessary.
Okay, thank you, Mr. Chair, and thank you.
You're welcome.
Are there any more questions? Oh, Vice Chair Alder Frank Douglas.
Thank you, Mr. Chair. So I'm sitting here and I'm thinking about the housing authority. Now they have Westville Manor, which is in disarray. There's a lot of vacancy out there that I noticed. And I'm not sure exactly what their position is, if they are able to move forward on the renovations that were proposed. If this could be a project incorporated in that project, or is that separate? Is there some money that we don't know about that's going to be taking care of that property? But something to consider. Thank you, Mr. Chair.
Thank you.
I'm not familiar with the details of that project, so something we'd have to look into.
Are there any more questions or comments from the committee? Seeing none, thank you. I will turn it over to my co-chair, Alder Brackeen.
Thank you, Mr. Co-Chair. We will now take public testimony. We will have staff, if you all don't mind, just kind of be on standby, just in case we may have follow-up questions. First, we have Mr. Jawan Carter. Please state your name and address for the record.
Good evening, everyone. I'm Jawan Carter. My address is 106 Poplar Street. That'll be New Haven, Connecticut. And what I would like to say is, in regards to the use of this money, there may be people who are in this transition period of, I would say, homelessness, and not just looking for additional services, but they may just need a place to stay and some employment. Is there a chance with people who are matched in that type of category, if they were to have a different, instead of a bigger nonprofit, but just a landlord itself who could probably be able to partner with these, I guess a nonprofit that you guys have mentioned. So where the wraparound services, it's not something that's outside of a landlord's threshold. It's just more so giving them a place to stay. And I guess with the rapid rehousing income, it allows them this cushion to probably find employment, right? Like I guess I'm not sure what the program entails. I don't know if rent will be paid for, let's say 2 months, 3 months. I'm not sure exactly because we didn't go into details on this. But take an example where rent would be paid for 3 months. That would be enough money, I guess, for them to probably do job applications or figure out where they could get their employment from. And then at that particular moment, they probably wouldn't need a bigger nonprofit, but they'll probably just need a private landlord who is a good community partner. As Alder Kim has mentioned, that some are not, some are good. But just for those homeowners, private land homeowners who is trying to do the best thing by providing good housing and opportunity, is there any type of avenue for them? Because it wasn't really discussed here, but can we put that part of the plan, right? Not just give it to a bigger nonprofit to grow, but for people who actually do pay taxes in the city to get opportunity to make money. My comment is over.
Thank you for your testimony, and a lot of great questions to be answered here. But before we get them answered, I'm going to ask if members of the committee have any questions at this time. Seeing none, I'm going to take the opportunity to turn it back to staff, Dr. Dalal or Ron, to address those questions.
Thank you, Mr. Chair. I appreciate the comments from Mr. Carter. I think it's a really good idea if there are individuals in the community that are willing to help out and just need a little more support. There were a number of questions that that Mr. Carter had that I didn't catch every single one of them, but I can provide a little bit of detail. The rental support for those who are rehoused rapidly from experiencing homelessness does go on for a period of months, sometimes 12 months and beyond. Are the previous dollars that were allocated from the CARES Act allowed for that level of support. So there's ample opportunity for individuals to, either, find employment or enter employment training. But to your specific idea around supporting individual landowners, I do not have the answer to that on hand on how much support is provided to those individual landlords. But it's something that we can look into, and I will speak to some of the nonprofits about that idea because I think it is a creative one. So thank you.
Thank you, Mr. Carter. Okay, just for the record, are there any other members of the public wishing to testify on this item? Are there any other members of the public wishing to testify on this item? Are there any other members of the public wishing to testify on this item? The chair will entertain a motion to close the public portion of this hearing.
I make a motion to close the public portion of this meeting.
Okay.
Hearing it moved and second, all in favor say aye.
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 Opposed say nay. Any abstentions? The public portion of this meeting is over. Thank you, Dr. Dalal and Ron. We'll now, Chair will entertain any motions for discussion. Oh, no, we will not entertain any motions for discussion. Due to the nature of this item, I'm going to state now that we will need to ensure that it is addressed at our next full Board of Alders meeting. And we will raise this item then. Mr. Co-Chair, do you have any other thoughts?
No, I don't have any other thoughts. Just want to thank everybody for coming out on a special meeting on a Thursday. And thank you, Ron Gizzi, for what you do, and Dr. Dalal, and what you do. Let's keep securing some dollars. Hopefully we can move this forward and help some homeless folks out. And thank everybody on the call. And I entertain the motion to adjourn.
Second.
All those in favor?
Aye.
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 Good night, everyone.
Night,
Night.
colleagues. Thank you.
Night.
Thank you.
Right.
Good night, everyone.